Dr. Mease, I would like to ask you about what do you think about the Young-GRAPPA initiative and its expected contribution to GRAPPA?
I think it's terrific. And it's another example where we got a great idea from a different organization. So we'll have to give credit to ASAS for having the idea first. Just as if you think back, the fact that Desiree's talk about ASAS in New York inspired me to think about organizing the GRAPPA meeting. I do think that this is a highly important initiative for several reasons. First of all, GRAPPA is a very large organization. There are many members. There are nearly 1,000 members representing dermatology, rheumatology, and a variety of other stakeholders. And so one of the issues that arises when you have a very large organization is how do you give people who are involved an adequate voice and ability to be involved and engaged. And I think that by establishing a strong interest group of younger individuals who are in the early stages of their careers, whether it be in private practice or in academic settings, this is a opportunity for them, first of all, to communicate with each other and to share ideas and inspiration. It's also because there is now if not a overt mandate, at least an expected mandate for every research project, educational initiative, and so forth, to have at least one Young-GRAPPian be represented. And this is a great way to bring younger people who otherwise might not be able to be involved into being active. And I know I can tell you in the initiatives that I'm involved with, whether it's the Collaborative Research Network or the GRAPPA textbook or educational symposia, it's just a delight to have on the phone call, planning phone calls, and then actually doing the project to have Young-GRAPPian representation. I didn't fully appreciate this until it's really been getting going, and now that I'm seeing what a terrific thing it is, I'm just bonkers over it. And I think that it parallels in some way the way in which we've given over the years a voice to the Patient Research Partner Group, which we were inspired to do originally by the OMERACT organization. That's another thing that Daphne pulled many of us into OMERACT, and we were inspired by the fact that OMERACT very strongly encourages to have patients involved who take part in the planning of research projects, the conduct of research projects, and the ultimate public presentation of work from our efforts. So I think that it's this is wonderful. It's going to be important for the Young-GRAPPians, I think, to have a strong sense of both geographic representation, representation across derm and rheum, and representation in terms of race, ethnicity, and gender. And we try to do that as much as we can in the older group, but I think that it's also important to do in the younger group. So that's going to be both a challenge and an opportunity for you.
I definitely agree with you, and it's such a great opportunity for the young members to collaborate with each other and also to learn from the senior members' experience and to also work with them closely.